Did you know that some subtle changes in your breasts could signal something serious? Every year, thousands of people ignore these warning signs, only to regret it later. But don't worry, we've got you covered. In today's video, we'll dive into 8 critical breast health warning signs you should never ignore. Trust me, this could save your life or the life of someone you love. Before we get started, don't forget to hit that subscribe button, click the like button, and share your thoughts in the comments below. Let's get the conversation started. All right, let's jump right in. Here are the 8 breast health warning signs you should never overlook. A lump or thickening in the breast or underarm. This is one of the most well-known and significant warning signs of potential breast health issues, and for good reason. A lump or thickening in the breast or underarm can often be the first noticeable symptom of breast cancer. While not all lumps are cancerous, it's important to note that any lump that feels different from the surrounding tissue or doesn't go away over time should be taken seriously. Some lumps are caused by benign conditions like cysts or fibrocystic changes, but others can indicate something more severe. What makes this sign even more critical is that lumps can form in areas you might not immediately associate with breast tissue, such as the underarm. This is because the lymph nodes in that area are closely connected to the breast and can swell or become abnormal due to underlying conditions. Regular self-examinations are vital in detecting these changes early. Be sure to feel for any hard, immovable lumps or areas of unusual thickness during these checks. If you notice anything unusual, don't panic, but don't ignore it either. Schedule a visit to your healthcare provider for a clinical examination and possibly further tests, such as a mammogram or ultrasound. Early detection is key, and acting quickly could make all the difference. It's always better to be safe than sorry when it comes to your health. Changes in breast size or shape. Have you ever noticed one breast looking or feeling significantly different from the other? Changes in breast size or shape are not uncommon, but when these changes occur suddenly or without explanation, they could indicate an underlying health issue. While minor differences between breasts are normal, a noticeable or rapid change in size or shape, especially if it's skin redness, dimpling, or texture changes. Have you noticed skin on your breast that appears red, irritated, or oddly textured? These changes, particularly if the skin starts to dimple or resemble the texture of an orange peel, could be a warning sign of inflammatory breast cancer, a rare but aggressive form of the disease. Unlike other types of breast cancer, this form doesn't always start with a lump, which is why these skin changes often go unnoticed. Redness or swelling that doesn't improve over time can also mimic signs of an infection, making it easy to dismiss. However, persistent changes in the texture or appearance of the breast skin should never be ignored. Dimpling occurs when fluid builds up or cancer cells block lymph vessels, causing the skin to pucker or tighten in an abnormal way. If you observe these changes, don't hesitate to seek medical advice. Early diagnosis and treatment can make a significant difference. Your skin may be signaling something serious brewing beneath the surface. Warning sign 4. Nipple discharge, other than breast milk. Unusual nipple discharge is one of those signs that can easily be overlooked, but it's important to pay close attention. If you're experiencing discharge from the nipple that isn't related to breastfeeding, especially if it's clear, bloody, or occurs without squeezing, it's a potential red flag. While nipple discharge can sometimes result from benign conditions like hormonal changes, infections, or non-cancerous growths in the milk ducts, it can also indicate something more serious, such as breast cancer. Bloody or clear discharge is particularly concerning and warrants immediate medical attention. Even if the discharge seems minor or occurs only occasionally, it's better to be cautious. This symptom can also be accompanied by other changes in the nipple, such as inversion or tenderness, which further highlights the need for a professional evaluation. Don't ignore this sign. Consult your doctor promptly to rule out any underlying conditions and ensure your breast health is in good hands. Warning sign 5. Persistent breast pain. Breast pain, also known as mastalgia, is a common issue experienced by many. It can often be linked to harmless factors such as hormonal changes during your menstrual cycle, pregnancy, or even stress. However, if the pain becomes persistent, localized to one specific area, and doesn't seem connected to these typical causes, it's time to take it seriously. Persistent breast pain that doesn't resolve over time could indicate a deeper problem, such as a cyst, infection, or, in rare cases, breast cancer. It's important to note the nature of the pain, whether it's sharp, burning, or feels like consistent pressure, and whether it comes with other symptoms like swelling, redness, or changes in breast tissue. Don't ignore ongoing discomfort or assume it will go away on its own. A thorough evaluation by a healthcare professional can help identify the root cause and provide peace of mind or early intervention if needed. Your body's signals are worth listening to. Warning sign 6. Nipple inversion or changes in appearance. Your nipples are an important indicator of breast health, and changes in their appearance should never be ignored. If you notice your nipple turning inward, flattening, or changing shape, particularly if it's a new development, this could be a warning sign of an underlying issue. While some people naturally have inverted nipples, a sudden inversion or flattening could be more concerning, especially if it's accompanied by other symptoms like lumps, discharge, or changes in the surrounding skin. Nipple inversion occurs when the tissue behind the nipple pulls it inward, and this can sometimes indicate conditions like a blocked milk duct, an infection, or, in more serious cases, breast cancer. The inversion may also be associated with tightening of the skin around the nipple or discomfort. If this is something new for you or seems unusual, it's important to consult a healthcare professional promptly. Early evaluation and treatment can help identify and address any underlying conditions effectively. Swelling or lumps near the collarbone or armpit? Did you know that breast cancer doesn't always show up directly in the breast? Sometimes it reveals itself in nearby lymph nodes, such as those near the collarbone or underarm. Swelling or lumps in these areas can be one of the first signs that cancer cells are present. These lymph nodes act as filters in your body's immune system, and when they're swollen or lumpy, it could indicate that something abnormal is happening. What makes this symptom tricky is that it's often less obvious and can easily be overlooked. The swelling or lump may feel small and tender or firm and immovable, depending on the underlying cause. It's crucial to pay attention to these areas during your regular self-examinations. While swelling near the collarbone or armpit could also be caused by infections or other non-cancerous conditions, it's always better to err on the side of caution. If you notice any unusual changes, consult a doctor immediately to rule out or address potential concerns. Unexplained changes in skin color or warmth. Have you noticed one breast feeling warmer to the touch or appearing redder than the other? While these changes can sometimes point to an infection or inflammation such as mastitis, especially in breastfeeding mothers, they shouldn't be ignored if you're not breastfeeding. Unexplained changes in skin color, warmth, or swelling can also indicate more serious conditions, like inflammatory breast cancer, a rare but aggressive form of the disease. These symptoms occur due to fluid buildup or blockage in the lymphatic vessels, causing redness, heat, and sometimes even pain. The affected area may feel tender, swollen, or irritated, making it easy to mistake for a mild infection. If you notice this kind of change, it's crucial to act quickly. Don't wait for it to resolve on its own. Schedule a checkup with your healthcare provider immediately. Remember, early detection and timely treatment can make all the difference when it comes to your health. If you found this video helpful, don't forget to hit that subscribe button for more life-saving tips every week. Show your support by clicking the like button and share your thoughts or questions in the comments below. Let's spread awareness and keep the conversation going. Until next time, stay healthy and informed. Outro music fades out.